This is really heartbreaking. There was a woman who was trapped between a subway and the rail, and she begs for bystanders not to call the ambulance because she can't afford it.
Both in developing countries and first world nations. I will also talk about how you can easily be trapped in insurance loopholes, which I'm sure you've heard about. But in this video, we'll go in depth about what insurance loopholes are and how they trick you.
Roughly 1 in 5 Americans report having medical debt, and the Consumer Financial Protection Bureau says that's a big problem. And there is potential fallout from insurance companies over this, correct?
There was bone exposed through her thigh.
Today, we'll explore various issues in the healthcare industry, including the corrupt practices in private and public hospitals, cases of overcharging, unnecessary surgeries, and organ trafficking.
Organ trafficking, organ harvesting is a hideous crime. For the facilitators, this is just business. They see these people as money.
Ladies and gentlemen, imagine you go to a hospital with great ratings and multiple awards to get treated. You'd feel confident in the service you're getting, right? What if I tell you that instead of curing you, they, the hospital, keep you on a 5-day ventilator straight, even though the doctors knew from the beginning that you were dead? The reason for this? To maximize the bill your family has to pay. Moving on from the fact that you've died and are now being headed to your family, you would expect a calm and peaceful funeral, right? But instead, the hospital charges you for the simplest things like gowns. This is the exact experience that 7-year-old Adia had to suffer. Now a question might be going through your mind. What hospital was this, and did they actually earn more profit by killing a young girl? Firstly, let me correct your question. Speaking realistically, there would have been millions of people like Adia who have suffered from this mishap. The answers may shock you, and it's also disturbing at the same time. Perhaps you may believe that your government will cover all of this for you. Well, in that case, you'd simply be wrong. You will have to pay for all of this from your own pocket. On top of this, the doctors start charging you for more stuff, like x-rays and blood tests. And I will talk about this later on, so pay attention. Do you know that you are advised to buy expensive salt when there is an exact same salt for a cheaper price, without any drawbacks? Do you know what the difference between generic and branded medicine is? Did you know that all of this is happening right now around us? In the same society that gives doctors the role of God, that doctor prescribes you medicine from the company from which he gets the most money from. Did you know that some of these doctors unnecessarily ask for x-rays or tests so that they can get more commission from your pocket? That's truly disappointing. If something is worth $1, it cannot be sold for $20. That's just how the market works. There is only one condition though. It can be sold if the doctor tells you. Otherwise, no one in the world wants to give extra money for the same thing. When you go to a medical store and ask for medicine, and they ask you to give the same medicine but from a different company, you flatly refuse. That's the level of trust you have in the doctor, the same doctor that you give the role of God. But this exact same doctor prescribes your medicines from the company from which he received money and bribes, including expensive gifts. The Pharma company has absolutely hijacked the healthcare system. In India, if you want to open a pathology lab, no matter how good you open up a lab, not a single man will come. After opening a pathology lab, you have to go and meet the doctor in that area, have to fix the rates with them, then people will come to you. This is the reason why doctors prescribe you 50 tests, even for small things, in the pursuit of making high margins. Some pathology labs do the sink test. The sink test basically means they will drain your sample, it can be your blood or urine, in the sink, and then they will give you fake reports. Doctors have proper sales targets in private hospitals. Sales review meetings are held, and the budget for every month is fixed. There's a type of surgery where basically you don't need surgery, but the doctors perform it anyways. And apparently 44% of all surgeries are this type. You don't even require surgery. Wherever you go for any treatment, you get a discharge summary. In it is shown step by step what was the problem and why the surgery was performed. You will see that most hospitals do not give you a discharge summary, which is incredibly important. So whenever you go to a hospital, you should ask at the end for a discharge summary. Thank me later for that one. The revelations about fraudulent surgeries in India are particularly disconcerting. Nearly half of the surgeries performed may be driven by profit motives rather than genuine medical necessity. This alarming statistic forces us to confront the harsh reality that our trust in medical professionals and institutions may be misplaced. But it doesn't end there. The tentacles of corruption extend into developed nations, with the US healthcare system grappling with its own set of challenges. The profit-driven model, underscored by cases of insurance fraud and overbilling, is a systematic flaw that prioritizes financial gains over the health and well-being of patients. Insurance is always thought to be a lifesaver. However, in reality, is it actually that helpful? Or are there actually any benefits? Let's find out. In India, a growing medical crisis, especially in major metropolitan areas like Mumbai, is plunging the middle-class population into poverty due to soaring treatment costs. Diseases like dengue and typhoid demand approximately 2 crore for treatment as of 2018 alone, with projections indicating a doubling of costs within the next 5 years. With average monthly salaries around 25,000 rupees, many Indians find it increasingly challenging to cope with these escalating medical expenses. Health insurance, once viewed as a luxury, is now considered a necessity to avert financial crisis stemming from unexpected medical emergencies. However, a significant portion of the population remains underinsured, with 68% lacking coverage for most major illnesses. The situation with 47% realizing post-hospital admission that their specific treatment is not covered, and 62% discovering that their chosen hospital falls outside their insurance coverage. To navigate this complex landscape, individuals are urged to make informed decisions by conducting thorough research or insurance policies, understanding terms and conditions, and being vigilant against potential scams to ensure comprehensive coverage at reasonable premiums. This is incredibly important, especially in a country like India. In this labyrinth of deceit, we've seen doctors succumb to the pressures of meeting corporate targets, with salary disparities creating an ethical quicksand. The intrusion of non-medical professionals into medical decision-making processes raises concerns about the erosion of medical ethics in the pursuit of monetary gains. Death because of doctors' negligence. This is truly something we shouldn't hear, but we do now. Did you know that the third leading cause of death in America is consulting a medical doctor? This means you go to a doctor, he gives you treatment, and at the end, you die from it. This means that 15,000 Medicare users die each month because of this. And guess what? Nobody goes to jail because of this. Now, you may think that these scams only happen in India or supposed third world countries. But let me surprise you with some scams occurring in first world countries like America. Yes, America does spend a lot on its healthcare, but it also has one of the worst. Why is the US healthcare system so deeply flawed then? The answer, quite simply, is money. a handful of corporations have turned healthcare into a trillion-dollar industry that prioritizes profit over human lives. While the US system appears dire to most foreigners, it's considered normal or even great by many Americans. However, the reality is far from ordinary. In a recent case, Californian orthopedic surgeon Gary Wisner had been found guilty of committing healthcare insurance fraud by engaging in an X-ray scam that targeted Medicare and Medi-Cal. Following a 2-week trial in Sacramento County Superior Court, Wisner was convicted on 10 felony counts. The investigation conducted by the Californian Department of Justice's Division of Medical Fraud and Elder Abuse revealed that Wisner had been overbilling the Medi-Cal and Medicare programs. So you can't really trust outside doctors either. What can we do? Not only that, but there are also additional instances related to X-rays. Have you ever considered the possibility of deception by X-rays? After all, X-rays reveal aspects that ordinary individuals might overlook. Timothy M.A., a former X-ray technician and vice president of Alpha Diagnostic Services, recently pleaded guilty to healthcare fraud in Maryland, involving over $2.5 million in Medicare losses. M.A., licensed as an X-ray technician, misrepresented himself by performing and interpreting various medical tests, including X-rays, on behalf of licensed physicians. The fraudulent scheme extended to ultrasounds and electrocardiograms, even conducted remotely and overseas. 13 years ago, it may accounted for over 70% of X-ray interpretations at the company, overbilling for tests and services. This is truly crazy, right? Countless times in the medical world where scams such as these have happened. The Department of Justice, DOJ, estimates that healthcare fraud generates close to $100 billion a year. In 2021, there were 831 new criminal healthcare fraud investigations. 805 new civil healthcare fraud investigations too. Did you know that 92% of the fraudsters are actually American and 66% of healthcare fraud perpetrators are men? Significant salary disparities between junior and senior doctors are identified, with new doctors reportedly earning $1 lakh per month and senior doctors earning up to 1 crore per month, which is a huge gap, potentially linked to meeting corporate set targets. The study underscores the pressure on doctors to meet these targets, with consequence for failure, including verbal warnings, memos, and potential termination. Moreover, the involvement of non-medical professionals such as MBAs in monitoring and enforcing targets raises ethical questions about medical decision-making. That is for real. The findings highlight that we need regulatory measures to ensure transparency, accountability, and ethical standards within the medical system, emphasizing the importance of a patient-centric approach over profit motives, which we are seeing now. Similarities when it comes to compromising the well-being of patients? It's a wake-up call, urging us the question of moral fabric of our healthcare systems globally. As we delve into the intricate web of exploitation, deceit, and of course greed that taints the medical field, we confront uncomfortable truths. We witness the dark underbelly of hospitals preying on vulnerability, turning a blind eye to the Hippocratic Oath, and in some instances, becoming accomplices to organ trafficking. That is truly heartbreaking to hear. The global reach of this epidemic is staggering, spanning across continents and nations. The names of countries implicated in these schemes may surprise you, challenging preconceived notions about the sanctity of healthcare, the extent of organ trafficking, the overpricing of life-saving surgeries, and the manipulation of insurance systems are not confined to a specific region, but permeate our interconnected world. How sadder can this be? Did you know that every year 3.5 million people die in India because of cardiovascular diseases? Now, to control this, 200,000 stent surgeries are taking place. A stent is basically where a wire mesh is transplanted into blood artery to regulate your blood flow. Let me tell you the most stupid part of this. For a small wire, these hospitals overprice people 654% more than a designated price. There is another example which took place back in 2019 when COVID started spreading. Yep, we didn't like that time, did we? And people were dying. When countries around the world were helping their people, in India, private hospitals were charging more than $1,000 for hospital beds. Hospitals such as Fortis, which are huge in India, overcharge its patients up to 108% on only medicine. Not just this, however, the hospital can also overcharge you 1,737% on consumables. You might be surprised for this fact, but just wait, that the MPPA has investigated that there are around 4 other hospitals in the capital of India that are doing this. Just the capital. Now, there is a common trend that you can notice from these scans. Most of the hospitals targeting people are indeed private. Now, I'm not saying that public hospitals are all good. They aren't either, but compared, private tends to do the bad deed. Can you also believe that 60% of the beds provided for COVID-19 were by big private companies like Fortis and Max? If you're an Indian citizen, you probably know that these hospital branches are very famous. Now, to conclude this chapter that we've talked about, I will break it into 10 points. Number 1, exploitative practices in private hospitals. A case where a 7-year-old girl named Adia, diagnosed with dengue, faced shocking exploitation by Fortis Hospital in Gurgaon. The hospital allegedly kept her on artificial ventilation, even when her brain and kidney were non-functionable, with the intention of maximizing financial gain. The subsequent bill amounted to an exorbitant 15.79 lakh rupees. 2 is investigation and systematic issues. Following the exposure of Fortis Hospital's practices, government investigations revealed that several hospitals in Delhi, NCR engaged in overpricing, with markups reaching up to 108% on medicines and a staggering 1,600% on consumables. This prompts the question that, are these countries actually playing us? 3 is financial exploitation amidst health crisis. Drawing attention to the broader issue of private hospitals overcharging patients for essential medical services, referencing data from the World Health Organization, WHO, attributing over 35 lakh deaths to heart-related diseases. The COVID-19 pandemic exacerbated these issues, with reports of exorbitant charges for a single hospital bed. Number 4 is the profit-driven healthcare. Exploring the profit-driven business model of private hospitals, which reportedly make up to 35% profit, the brand equity report indicates that 70% of hospitals in India are privately owned, dispelling the misconception that only high-end hospitals engage in exploitive practices. 4 points of injustice in Adia's case. Now, in her case, there were 4 things that were basically done that were in the wrong. These were obviously emphasizing the ethical and moral lapses in the healthcare system. These included keeping a terminally ill patient on life support, overcharging grieving parents, billing for a gown, and refusing to provide an ambulance or a death certificate, which they had to do from a different hospital. Exploitation in a premature birth case is the sixth one. Citing another disturbing case involving Max Hospital in Delhi, where premature twins were declared dead, leading to a tragic outcome. This incident raises concerns about the negligence of reputable healthcare institutions and their impact on patients. Number 7 is the market dominance of private hospitals, as we can see is 70%. Only a few expensive hospitals engage in malpractice. Let's assert that the majority of hospitals in India are privately owned. Private players reportedly dominate the healthcare market, and 60% of hospital beds are during COVID-19 pandemic were theirs. Number 8, financial burden on patients. Let's now discuss the financial burden imposed on patients, citing examples of patients being charged exorbitantly for procedures, diagnostics, and medicines. Hospitals inflate prices, particularly on consumables, leading to significant financial strain on patients and their families. Number 9 is ineffectiveness of publicly funded schemes. Would you like to now question the efficiency of publicly funded healthcare insurance schemes, such as any government basically started schemes that were meant to help the people? Many registered hospitals reportedly failed to provide adequate treatment under these schemes, forcing patients into the hands of private hospitals. And lastly, we have the government's role and proposed solutions. Let's now address that the government's role in regulating private hospitals. It basically highlights the inadequacy of the Clinical Establishment Act, emphasizing the need for proper implementation. We basically need 3 solutions: increasing expenditure on public healthcare, implementing rigorous hospital auditing, and fostering public awareness to hold the government accountable. I hope that summarizes this chapter well. Now let's move on to the second one. Private hospitals often excel in delivering superior healthcare due to their ability to invest in high-quality equipment and attract skilled facilitators. The key lies in their focused audience. Private companies concentrate on satisfying a single clientele. In contrast, the government shoulders the responsibility of catering to diverse sectors, allocating funds across various areas simultaneously. This broader spectrum of obligations makes it challenging for governmental bodies to consistently offer the optimal equipment, workforce, and essential services that private institutions, with their more concentrated efforts, can readily provide better. If you would like more information on different types of countries, you can take a look at this graph, this will make it better for you to understand. October 2016, Pakistan. Police freed 24 people from an apartment block in Rawalpindi. They were due to be taken to a nearby hospital for forcible kidney removal after months in captivity. Back in 2018, Sangeeta Kashyap was looking forward to a fresh start. The offer was almost too good to be true, even. A stable job in Delhi with a generous salary and the dream of building up her savings and retirement fund. The day after her arrival, she was taken to a clinic somewhere in the city. She was told that her employers required a medical check. A few days later, she overheard herself described as a kidney donor. Despite threats, she took the matter to the police. This industry is now worth $1 billion a year. Situation arises where a loved one is in need of financial assistance. You can't help them, so they visit a hospital for a routine checkup. Shockingly, instead of receiving appropriate medical care, corporate doctors manipulate your relatives into engaging in illegal organ trafficking activities, exploiting their vulnerability for unethical purposes. That's truly concerning that stuff like this is still happening in 2023, where we call ourselves a modern society. What's the point if this sort of stuff is happening? If you know what I mean. It's truly concerning. And even in Egypt, refugees who are already vulnerable, they make for a captive client base as they pass through their way across the Mediterranean. Selling their kidneys to smugglers is a way to pay rent and afford food for themselves and their family. We can't really blame them, but of course, there are ways other than sacrificing themselves to earn money and pay rent and afford food for their families. It's truly concerning, and nobody should, have to deal with this. But as we confront these uncomfortable truths, it becomes clear that a systematic overhaul is imperative. The role of governments is regulating and auditing hospitals cannot be overstated. Increased expenditure on public healthcare, coupled with stringent enforcement of ethical standards, is essential to ensure that profit motives don't take precedence over patient care. This expose serves as a rallying cry for awareness, accountability, and change. We must demand transparency from the institutions entrusted with our health, change the status quo, and work collectively to dismantle the perverse incentives that jeopardize the sanctity of healthcare. Let this be a call to action, a catalyst for reform, and a testament to the resilience of the human spirit. In the face of systematic betrayal, the time for change is now, and together we can reclaim the integrity of healthcare for the well-being of all. Thank you so much for watching this video. I hope this helped you learn something, and I'm sure you will benefit from this because healthcare is everywhere and you need to know about these scams that are going on in the world right now. So thank you so much, and we'll meet next time. Bye!